Hello friends, I hope you and your family are safe at your home in this pandemic. As a medical profession, as a medical students, you should be aware about the ongoing pandemic, and it becomes our moral responsibility to make you aware about the signs, symptoms and clinical management. So from the directives of government and our administration, these training sessions are organized for you. At this juncture, I would like to thank Dr. Milav Bhavsar, Dr. Viral Chauhan, Dr. Gaurang Algotar to provide technical support in organizing the logistics of these training sessions, and I would like to thank the faculties of our medical college, Dr. Sanjay Mehta, Dr. Kunjan Kekani, Dr. Pratik Jasani and Dr. Shyam Shah to give you bird's eye view about this horrifying pandemic. So as a training session, as a part of medical education unit, these training sessions are arranged to make you informed about this pandemic. Thank you and welcome on board.
Hello friends, welcome to the session Introduction to COVID-2 virus and COVID-19 disease. The first session of the training. The coronavirus is RNA virus, single-stranded, and approximately the size is 120 to 160 nanometer, which is a spherical envelope virus. It is very interesting to know that this particular shape, which is envelope, having on the surface spikes, will give a typical appearance like a crown, and that is why this virus is called as coronavirus. The virus nucleic acid has got an helical symmetry. Now, there are 4 genera of this coronavirus: alpha, beta, gamma and delta. These viruses are prevalent in animals and birds. Only few of them are pathogenic to human beings, and the important pathogenic coronaviruses are HCoV229E, HCoV-NL63, HCoV-OC43 and HCoV-HKU1. These viruses are very much prevalent in environment, and routinely they cause upper respiratory tract infection, which is manifested as common cold. Or sometimes it can also lead to GIT involvement and manifested as diarrhea. As said, that these viruses are very much prevalent in environment, and it is also prevalent there in animals and birds and human beings also. So what happens is a phenomena which is called as virus spillover. The virus which are prevalent in wild environment, wild animals, with the help of the vectors, they spill over to the domestic animals. And from domestic animal, there is one more spillover which will ultimately target the human beings. And when human beings first encounter such type of virus, it will lead to epidemic or pandemic. And you can see such type of food market, also called as wet market, where animal products are sold, play a very pivotal role in spillover of such type of viruses from animals and birds to the human beings. This coronavirus has typically caused some important clinical syndromes that we know. The first one is SARS, that you can see severe acute respiratory syndrome. Another is MERS, that is Middle East Respiratory Syndrome. The SARS, which originated in China in 2003, has led to something around 8,000 cases and 774 deaths, while in MERS, that originated there in 2012 in Saudi Arabia, led to 2,143 cases with 750 deaths. Now, another virus, that is what we are facing, a pandemic of SARS-CoV-2. The disease is called as COVID-19 and it has led to a pneumonia, also called as SARI, severe acute respiratory infection. And if you see the statistics right now in the world, this COVID-19 worldwide has caused 2,23,08,044 cases till today, 7,84,365 deaths. In India, the total number of the cases are 27,86,670 with death of 53,026. While in Gujarat, you can see 80,940 cases are there and death of 2,820 patients. So this virus is causing a pandemic and we all are experiencing this pandemic for quite few months. There has been speculation about the origin of this virus and there are two theories of the viral origin. The first one is natural selection. So, as it has been explained in earlier slide, the virus is there circulating in animals and birds, adapts to the human being and it causes pandemic, and this is called as natural selection. While other is a bioweapon, right? Where army of a certain country in the world, they prepare such type of viruses and it has been used in biological warfare, right? But we don't know about the fact exactly what is the origin of coronavirus 2. You can see, we are not going to read this entire publication, but if you just go through the headline, severe acute respiratory syndrome coronavirus as an agent of emerging and re-emerging infection. Now this publication says that this virus is there in circulation. You can see the location is Hong Kong and the year is 2007. And over here, it has been said that SARS can return if conditions are fit for the introduction, mutation, amplification, and transmission of this dangerous virus. So many of the viruses are prevalent in animals and birds, and it is natural for them to spill over into the domestic and then to the human. You can see when such type of thing happen, virus will adapt from animals and birds to the human being, and there would be index case, and as per the authority, Chinese authority, they have identified this particular person is one as the first or patient 0 of COVID-19. This virus has got a transmission. The first is zoonotic transmission, where you can see the wild animals and birds. In case of corona, it is bats, and then it gets spilled to the domestic animals, and in this case it is pangolin, and then it gets transmitted to the humans. The next stage comes human to human transmission, right? And the route of transmission are the droplets, the fomites, aerosol, and fecal oral, right? But still there is some dilemma and debate about the fecal oral transmission and airborne transmission. If you look at the overall transmission of this virus, the infected individual will spread the virus through respiratory secretions via coughing and sneezing. When that happens, the infected individual, while coughing and sneezing, will produce droplets. Now, typically, the droplets are larger size particles, that is more than 5 micrometer in diameter, which can travel less than 1 meter distance, and they would settle down in nearby area. Now, these droplets can directly infect individual if another individual is within that vicinity, or this droplet will settle down onto any other surface, and from there can happen indirect spread, either through the body part where it will direct spread, or through other surfaces like the bed or other surfaces, linen, and this is indirect transmission, right? While what happens, there are droplet nuclei which are also formed, and these droplet nuclei are very small in size, usually less than 5 micrometer in size, and which can travel for more than 1 meter. And when such type of droplet nuclei form, they can be suspended in air for a long time, and they will travel far distance, and such type of spread is called as airborne spread. So it is very important to differentiate between these two. The first is droplet, over here the larger particles, and infection would happen within the vicinity, while other is airborne transmission, in which the smaller particles will travel farther away and will infect the individual who are at far distance. Now, there is a big controversy about how long or how far this virus particle would get transferred and transmitted. You can see over here, within 1 meter of the distance, right, these larger particles, they are called as droplet, will settle down. So if the individual who is not infected is within this vicinity, 1 meter, he will get direct infection by droplet. But if there is airborne, where this droplet nuclei can travel far away, and you can see it can travel up to 10 meter distance. Now it is very difficult to differentiate whether the virus would be transmitted by droplet or it would be transmitted by airborne, because the size of this droplet and droplet nuclei which is being formed by coughing and sneezing depends on various parameters, and it is impossible, right? So you can see the droplet size can be from 100 micrometer to less than 5 micrometer. So preferably, when we talk about prevention of the disease, at least 2 meter distance is what is being advocated by various authorities, including World Health Organization. Another thing which is very important is about the stability of the virus. It has been published in certain important journals, in which it has been said that the virus would be stable in aerosol for few hours. But the most important part, if it is a cardboard, it can stay up to 40 hours. If it is plastic, it can be there for 60 to 80 hours. So virus would be stable on such type of surface, and these all things will play a very important role in indirect transmission of the virus. Now we come to the sample collection and laboratory diagnosis, right? So what is to be collected is nasopharyngeal swab or oropharyngeal swab. You can see over here with a long stick and the swab, the secretions from the posterior pharynx, nasopharynx, oropharynx, needs to be collected. The collection of the specimen is to be done only on virus transport media or VTM. This VTM contains certain nutritional substances and stabilizing agents, so the fragile virus will not get destroyed or inactivated. The next part is sample packaging and transportation. It is very important when the sample is collected, immediately it should be packed in a triple layer container. So this is a typical example of a triple layer packing, where the first one is in which the swab is being kept inside, usually a plastic container. The second one is a waterproof packing, right? Another plastic container. And third one is rigid outer packaging. Remember this, that triple packaging is very important, number one. And second, it should be maintained in proper cold chain. So if it is not maintained in proper cold chain, virus will get deactivated. So with this typical triple layer pack, this sample should be transported to the laboratory where the test would be performed. Now there are various tests for laboratory diagnosis. One is antigen test, rapid antigen test, then antibody test, and RT-PCR. RT-PCR is considered as gold standard test for the diagnosis. You can see over here the sample is collected, and in a laboratory designated BSL level 2 laboratory, this RT-PCR is performed. From the sample, RNA is extracted. RNA is reverse transcribed into DNA. Then there is a polymerase chain reaction, and this DNA is polymerized. Now this is real-time PCR. So what happens that when the polymerization is happening, there will be a indication by fluorescence in a real time. So when the test is proceeding, the results we will get on a computer monitor, and you can see a graph will be plotted, and with the help of this graph we can identify whether the test is positive or it is negative, right? Thank you. So over here we end with the introduction of virology part. For any question, any query, you can always contact us.